Hello everyone, welcome back. Today we are going to be looking at osteology of the vertebral column. By the end of this video, you should be able to describe the general function and regional divisions of the vertebral column. You should be able to identify the typical structures of the vertebrae. You should be able to differentiate the distinguishing osteological features of cervical, thoracic, lumbar, sacral, and coccygeal vertebrae. You should be able to explain the normal curvatures of the vertebral column and their significance. You should be able to classify vertebrae into typical and atypical based on morphological characteristics. You should be able to locate and name the important bony landmarks. That's the vertebral foramen, intervertebral foramen, sciatic, sacral hiatus. Now, as a way of introduction, the vertebral column is a flexible, segmented bony column. It is segmented that forms the central axis of the skeleton. If you've not seen an image of a vertebral column before, here you have it. It is a bony segmented part. It has segments. We have the cervical, we have the thoracic, we have the lumbar, we have the sacral, we have the coccygeal, and it serves several functions, which include supports the head, upper limb, and the trunk. Protection, it encloses the spinal cord and protects it within the vertebral canal. Provides movement due to its ability to provide site for attachment of muscles and allows movements like flexion, extension, lateral bending, and rotation. It serves hemopoiesis, which is because it contains the red bone marrow, so it helps in synthesis of blood cells. And posture and shock absorption helps to transmit the weight of the body to the lower limb. So we are going to look at the vertebral column, look at the cervical, thoracic, lumbar, sacral, and coccygeal vertebrae. Now, the way of general structure of a typical vertebrae. Take note, a typical vertebrae. The typical vertebrae, cervical, thoracic, lumbar, consists of two main parts. There are other parts, but we are looking at the two main parts. The vertebral column, the vertebral body, which is also called the centrum. It is the anterior. Let me show you an image. This is the vertebral body. So this is it. This is it. It's first part. This is for a superior view. This is for a lateral view. You have the body, looking at it superiorly and looking at it laterally. So now let's do this. It's the anterior cylindrical mass of bone. It serves weight-bearing function. It's the weight-bearing compartment of the vertebrae. It increases in size from superior to what? Inferior. From cervical to lumbar. From what? Cervical to lumbar. It increases in size. We have the vertebral end plate, superior and inferior surfaces that are covered by hyaline cartilage. It is separated by intervertebral discs, which means one vertebral body is separated from the next vertebral body by an intervertebral disc, which means in between these vertebrae T1, T2, T3, T4, in between them is an intervertebral disc. Now let's look at the vertebral arc, which is the second part of the vertebrae. This is the first part, which is the body. This is the body. This is the second part, which is the vertebral arc. So there are two main parts, the body and the vertebral arc, also called the neural arc. Now, the posterior portion of the vertebrae is formed by the vertebral arc. It forms the posterior portion. If you look at this image, this is anterior here, this is posterior here. So it forms the posterior portion, forming the vertebral foramen. Forms the vertebral foramen. Look at this space you have here. Vertebral foramen. It forms the vertebral foramen. It is composed of pedicles, which are short, thick processes attaching the arc to the body. And we have the laminae, which are flat plates forming the posterior roof of the arc. So we have pedicles, we have laminae. This is the laminae we have here. Let's do away with this so that we'll get space to talk about this properly. So we have the laminae and we have the pedicles. These are the pedicles. The laminae and the pedicles together, they help to attach the arc, the vertebral arc, to the body. Okay, good. So yes, we have 7 processes. We have the spinous process, which is just one. This is it. You have the spinous process. Let's do away with this so that we would have space. So we have the spinous process, which is that. We have the transverse process, which are 2 and project laterally. The spinous process projects posteriorly and inferiorly. If you look at it from the superior view, projects posteriorly. If you look at it from the lateral view, it projects posteriorly and inferiorly. That means posterior inferiorly. So projects posteriorly, and it is palpable and often inferiorly. And for the transverse processes, they project laterally and they are sites for muscle and ligament attachment. These are the transverse processes. This is one on this side and one on this side. So we have 2 in a typical vertebrae. Then we have the articular processes, which are 4. We have superior and inferior. Each bears an articular facet, forming the zygophysial joint. Now, if you look at this, we have superior articular facet. Look at one here, 1, 2. If you go down inferiorly, you have one on this side, and on the other side you have another one. So this is 1, 2, 3, and that on the other side, which makes it 4. So we have 4 articular processes, we have 2 transverse processes, and we have 1 spinous process. Now we have spaces where we have the vertebral foramen and we have the intervertebral foramen. The vertebral foramen, I already mentioned it, where it contains the spinal cord. Vertebral canal contains the spinal cord. It's a bony hole formed by the body and the arc collectively to form the vertebral canal. While for the intervertebral foramen, it is a notch between the pedicles of adjacent vertebrae, which means in between adjacent vertebrae there is a space. If you look at the vertebral column laterally, you see an opening, which is referred to as the intervertebral foramen. It's a passage for spinal nerves. This is our intervertebral foramen. These spaces you are seeing here, intervertebral foramen. So it serves as passage for spinal nerves. Now let's look at individual vertebrae. We have the cervical vertebrae, which the typical ones are C3 to C6. Generally, we have C1 to C7. C3 to C6 are typical cervical vertebrae. They have a body which is small, broad, and concave superiorly. They have a vertebral foramen which is large and triangular in shape. We have a transverse process that contains the transverse foramen for vertebral artery and vein. We have the spinous process which is short and bifid, like a fork. It is short and bifid. See it here. It is short and bifid, like a fork. So we have the atypical cervical vertebrae, which is C1, C2, and C7. Now, when we say they are atypical, which means they have some special characteristics or features on them. So for C1, it has no body. There's no body. There is no spinous process. Take note of that. There's no body. There's no spinous process. It is ring-like. Look at this. It is ring-like in nature. It is ring-like in nature. That's C1. There is no body and there is no spinous process. Ring-like in nature, has an anterior arc and a posterior arc. Does not have a body. Has lateral masses which articulate with the occipital condyles of the occipital bone. We have C2. It has a dens called the odontoid process. You can call it dens, you can call it odontoid process. It projects superiorly from the body of C2, and the dens will act as a pivot for the atlas. You know, C1 is called the atlas, C2 is called the axis. Don't forget that. C1 cervical vertebrae is called the atlas and C2 cervical vertebrae is called the axis. So the odontoid process on the axis, which is C2, forms a pivot joint with the C1, which is the atlas, that helps for rotation. So it helps for these two bones, the joint between them helps for nodding and helps for rotation of the neck. Specifically rotation, the joint between C1 and C2 helps for rotation of the neck, while the joint between the occipital condyles and the C1, let's say this is the occipital condyles. So the joint between the occipital condyles and C1 helps in nodding, while the joint between C1 and C2 helps in rotation of the neck. So we have the C7, which it has a long bifid spinous process and is palpable at the base of the neck. If you place your hand on your neck and you trace it downward posteriorly, you feel a bony projection posteriorly. That is the spinous process of C7 cervical vertebrae. So these are images of the cervical vertebrae. This is the cervical vertebrae we are looking at here. So we have these images for you to look at. You can take time to pause the video. This is the dents on C2, and this is the C1, which is ring-like, and this is C2, which has a dent. So together they form a joint. So we have the thoracic vertebrae, which is T1 to T12. The typical ones are T2 to T8. They share all these features. They have a body which is heart-shaped, which is larger than cervical. Remember, we said the body increases as you go down. We have the vertebral foramen, which is small and circular. We have a costal facet called the demifacet on the body for articulation with the ribs. We have superior articular facet. This is the thoracic vertebrae. This is the body. So we have the transverse process, which has transverse costal facets. We have the spinous process. We have the articular facets. Spinous process, there's just one posteriorly, which is long and slender. Articular facets, which are 4 vertically oriented. They limit flexion and extension and allows rotation. They limit flexion and extension and allow rotation. Now for the atypical thoracic vertebrae, T1, has full facet for the first rib and sometimes a transverse facet, sometimes a transverse facet, and has a full facet, not a demifacet like the others. From T2 to T8 they have a demifacet, the costal facet, but for T1 it has a full facet. For T9 to T12 they have one pair of complete costal facet. It is complete, but it's just a pair, one pair, so you have per body. So that's that about that. This is the thoracic vertebrae, specifically T5, that we are looking at. So he has a vertebral body, he has a superior costal demifacet, has a vertebral foramen, transverse process, transverse costal facet, spinous process, as we can see, and a lamina pedicle. So moving to the lumbar vertebrae, it has a body. Now here we don't have typical and atypical. We have a body which is massive and kidney shaped. Don't forget, kidney shaped. The body of lumbar vertebrae is kidney shaped. We have a vertebral foramen. We have a spinous process which is short, blunt and horizontal. We have a transverse process which is thin and long. Accessory process on the base. We have an articular facet which is sagittally oriented, and we have a mammillary process which is small elevation on the superior articular facet. A small elevation on the superior articular facet. This is our mammillary process and other parts of the lumbar vertebrae. Remember, we said it is kidney shaped. The body is kidney shaped, gives an appearance of the shape of the kidney. So that is it for the body. For the sacrum, it is composed of 5 fused vertebrae, S1 to S5. It is wedge shaped, concave anteriorly. Look at this image. This is the anterior aspect, the anterior view. It is concave anteriorly. It has a base. The base of S1 articulates with the L5 vertebrae, where we have the promontory, which is the base here of S1 articulates with L5, forming the promontory. You have an apex which articulates with the coccyx. We have median sacral crest, which are fused spinous processes. Median sacral crest, which are fused. The spinous processes of S1, S2, S3, S4, S5 fused together forms the median sacral crest. We have the sacral foramina, which are 4 pairs anteriorly, 4 pairs posteriorly to transmit nerves and vessels. These are the sacral foramina. These openings 1, 2, 3, 4 anteriorly and posteriorly. We have the sacral canal, which is a continuation of the vertebral canal. We have the sacral hiatus, which is an inferior opening of the sacral canal and is a site for caudal epidural anesthesia. Sacral hiatus is a site for caudal epidural anesthesia. We have articular surface which articulates with the ilium to form the sacroiliac joint. From the articular surface that forms the sacroiliac joint. We have the sacral hiatus, an opening for caudal epidural anesthesia. So we now have the coccyx, which are 4 fused rudimentary vertebrae. They are rudimentary, cox 1, 2, cox 4. They provide attachment for pelvic floor muscles, the levator ani muscles, and the clinical importance or clinical note, you should know that they can be fractured by a fall on the buttocks, which is called painful coccydynia. When one falls from a height and lands on their buttocks, they are likely to have coccydynia, which is as pain felt around the coccyx or the tailbone. So the normal curvatures of the vertebral column. Now if you look at this image, you see that the vertebral column is curved, right? So we have a curve around cervical part, we have a curve around the thoracic, and we have a curve around the lumbar and around the sacral. So now we have the cervical. We're looking at it from the if you look at this, looking at it from the anterior view, cervical is convex anteriorly, then it is the thoracic is concave anteriorly. So this convexity, we call it lordosis, and the concavity, we call it kyphosis. So for the lumbar, it is convex anteriorly. For the sacral, it is concave anteriorly. So the primary curvatures are the thoracic and the sacral. Thoracic and sacral, they are the primary curvatures, thoracic and sacral. Take note of that. While the secondary curvatures are the lumbar and the cervical. So that is that about that. Now, clinical abnormalities. Looking at it from the sagittal plane, clinical abnormalities, we have kyphosis. Now, kyphosis can be tagged as abnormal or excessive thoracic curvature, like hunchback. Hunchback can also be called humpback. Take note of that. Any of that is correct. Humpback or hunchback. We have lordosis, which is excessive lumbar curvature. Look, this is normal. Kyphosis, excessive thoracic curvature. Lordosis, excessive lumbar curvature. This is normal. If you're looking at it from a coronal plane, you will see we also have scoliosis, which is a lateral curvature and rotation, lateral curvature of the vertebral column. So applied anatomy, we have vertebral canal stenosis. Stenosis is narrowing. It refers to narrowing, the narrowing of the lumbar and sacral canal. And remember, we have our spinal cord in this vertebral canal, so it can cause compresses the cauda equina and result in neurogenic claudication. We can also have herniation of the intervertebral disc. Remember, we say in between the vertebrae are intervertebral disc. So this vertebral disc can be herniated. In the vertebral disc, we have a video on that. It consists of an inner part and an outer part. So the inner part can easily be herniated, which is the most commonly herniated part, resulting in herniation of the intervertebral disc, and it can cause, and the common side is commonly posterolaterally, can compress spinal nerves in the vertebral column, in the vertebral foramen, and cause loss of sensation and motor function. We also have landmarks for procedures. C7, like I said, is a prominent spine, and it helps for counting the vertebrae. If you want to count the vertebrae, it's easier when you identify the C7, which is the most prominent. The sacral hiatus, remember we said, is for caudal epidural anesthesia, give injection. We have the iliac crest, which is a landmark for lumbar puncture. Iliac crest is landmark for lumbar puncture. Now see the herniated disc that we're talking about. This is the disc when it is herniated. So a nerve can be compressed here. So a healthy disc and a herniated disc, that's a difference. So it can cause spinal stenosis, causing nerve compression, and this is a compressed nerve root, and this can be inflamed and cause pain. So thank you for watching Don't forget to like, share, and subscribe to Alacrity Explains Anatomy for more videos. Turn on the notification button so that you get a notification anytime we drop a video. Thank you.